Is Synthroid making you feel worse? Maybe you're on T4-Only and your doctor's telling you that your labs are normal, but you still are gaining weight, you can't lose weight no matter what you do, your hair is falling out, and you want to take a nap every single day at around 2 p.m., if you can even get through your day. Here's the problem with Synthroid or Levothyroxine or Tirosint. Here's the problem with T4-Only. T4-Only is actually the standard of care in our medical system, meaning the doctor will test your TSH, and if TSH is above that 4.5 cutoff, then they'll give you T4, pat you on the back, send you out the door and wish you luck, and tell you, we'll retest you in 6 months. Meanwhile, the scale keeps going up, your clothes are getting tighter, you're getting more and more tired, and you keep counting the hairs that fall out of your head after the shower. T4-Only only works in 2% of the population. 2%. 98% of us need T4 and T3, or sometimes even T3 only. Now you ask, well, why? If this is the medication that all doctors give out, why isn't it not working? Well, you have to understand what T4 is. T4 is one out of many, it's actually 1 out of 4 different thyroid hormones that your thyroid gland makes. Now we really focus on T4 and T3 in labs. So we can test your inactive thyroid hormone, T4, and we can test your active thyroid hormone, T3. So now I just said a little snippet, right? T4 is inactive. That means that there's not a single cell in your body that can accept T4, that can attach to the T4 thyroid hormone. T4 has to go through a conversion process. It literally has to become the active thyroid hormone T3. Your cells have a receptor site on it for T3, just not T4. When T4 converts to T3, that's a beautiful, wonderful thing. But what if it doesn't? If it doesn't convert properly to that active thyroid hormone, what we will see in your labs is reverse T3 increasing. What does this mean? Okay, we gotta break it down. Reverse T3 is a marker that we can test for in your thyroid panel that shows us how well you convert that inactive thyroid hormone to the active thyroid hormone. When reverse T3 is above a 12, your body is in a hibernation mode. It basically shuts down and says, this person doesn't need to burn fat, doesn't need to have energy, doesn't need to have long, luxurious hair. In fact, let's just get rid of that hair. We never want elevated reverse T3. And the only thing that converts to reverse T3, the only thing that can push up your reverse T3 level and put you in that hibernation state is T4. So when your doctor gives you T4-Only, just keeps increasing your dose, more and more and more T4, and you're getting worse and worse and worse, it's because you're having problems converting that inactive thyroid hormone to the active thyroid hormone. And we need help with that conversion. How do we help with that? We use T3. Now there's many other things we can add in as well, and we'll talk about that in another video. But just know this, if you are on T4-Only, you're probably going to continue suffering with hypothyroid symptoms. Remember, 98% of us need T4 and T3, or even T3 only. Chances are you're not in that 2% of the population that do well on T4 only. If you're listening to this and you're gaining weight and you're not feeling better and your energy's in the toilet and you're losing your hair and your joints hurt and you can't even go to the bathroom every day, then it's most likely that T4 medication that you're taking. It's most likely because your doctor has you on T4 only, won't give you any T3 whatsoever, and just blows you off when you say, hey doc, I don't feel well. Be your own patient advocate. Learn about this, just like you're doing right now, and ask for that active thyroid hormone. And if your doctor says no, then it's time to get a new doctor, because you ultimately deserve to live your best life. You ultimately deserve to look, feel, and perform your best. You deserve to be that badass human that you're meant to be, and you're not going to get there on T4 only.